agenda is to replace public health care, and they want to do it by breaking the existing system. The playbook involves it breaking our existing system so they can justify it with replacing it with their preferred system. So they cut spending, they cut staffing, they fire leaders who will defend the system. And then they say it's broken. But don't worry, they say, let us fix it. And their cure, surprise, surprise, is privatization. But here's the thing. Albertans aren't buying what they're selling. Do you want American-style for-profit health care? No! Do you want two-tier health care? No! Do you want an expanded role for corporations and insurance companies? No! Do you want co-pays and deductibles? No! Albertans don't want any of the things that are on offer from the UCP. Now, that's not to say that our public health care system is perfect. Far from it. But we fix our system by building it up, not by tearing it down. So what are the real solutions? How about pharmacare for all? How about better preventative care and better home care? How about hiring more nurses and doctors and other healthcare assistants instead of chasing them away during a pandemic? There is a better way for healthcare. There are better solutions, but none of those solutions involve cuts and privatization. I want to finish this afternoon by doing two things. First, this is Nurses Week, so I want to thank all the healthcare workers who are doing everything they can for us. But we're also here to tell some personal stories. You may have seen people circulating handbills in the audience as you gathered, directing you to a website where you can tell your personal story about your family's personal experience with healthcare. And now that I'm up the microphone, I want to tell you about my family's experience. And it starts with a story about my son, Jack. He's over here holding the Alberta Federation of Labor's flag. Jack has epilepsy, and he's had it since he was young. For most of his life, it was well controlled by medication. But in grade 10, a few years ago, when he was playing basketball for the Scona Lords team, he had a tussle under the net, going up for a rebound, and he came down hard, banged his head, and his seizures came back with a fury. So bad that for a year and a half, he wasn't really able to attend school. But the medical staff at the University of Alberta Hospital, especially the staff in the neurology department, they had a solution, but it involved brain surgery. So my son, who had been so athletic, straight A student, hadn't been able to attend classes for a year and a half. That was the solution that was presented to us, brain surgery to address the problem in his head. As a family, we were terrified. But during that terrifying experience, the healthcare staff, especially the staff in the neurology department, they were there for Jack throughout that ordeal, and they were there for our family. And so when he underwent his surgery, it took the better part of a day, more than 13 hours in the OR. But a few hours later, after they had wheeled him out, I was able to sit next to my son as his eyes opened and he came back to the world, to the family, and to his life because of the surgery that was delivered through our public health care system. And the point I want to make today is not only did it give my son his life back, as a family we were able to focus on what was most important, which was his care, his health, and his recovery, never once did we have to worry about whether we could afford the care he needed. So today I want to remind all of us have stories like this in our families. And today I want us to remember those stories, and I want us to thank the healthcare workers that provide us with that kind of care, and the healthcare system that makes sure that it's there for everyone.